Salam and peace. You're watching Muslim Network TV on Galaxy 19 satellite, Amazon Fire TV, Roku, and Apple TV. Now, of course, a whole lot of social media. You can watch us also on our own website, muslimnetwork.tv. That is muslimnetwork.tv. This is First American Muslim Television, broadcasting through satellite and streaming live, an interesting conversation, 8 hours of original programming, repeated 3 times a year. The question which I'll be wondering and looking for answers is that if you're a poor and you're a minority and you're sick, whether it's COVID-19 you're worried about or a general thing, where do you go? Assuming you have no health insurance. We faced the dilemma in Chicago, and there was a community organizing group, United Power, and we deliberated on it. We said, why not in a state of Illinois, anyone who cannot afford an insurance, they should cover that. We tried and we failed. And that's where in that executive committee meeting, I gave this suggestion, what about we say at least we cover all children under age 18 and under, that if parents cannot afford, they do not have insurance, they should be covered by the state of Illinois. Well, it was received well in the executive committee, and then we organized 300 leaders, and then we organized several thousand in an assembly. And it took us less than 8 months that state of Illinois, from being the 48th worst state when it comes to healthcare in the country, that is way before the Obamacare and all that, it became the second best. How did that happen? That happened because people worked together, organized themselves, and ensured that they advocate. And that's what happened during the civil rights movement. People who were concerned about the civil rights, they were also concerned about the poverty. So in the original civil rights bill, there was a provision for community health centers. And it's an amazing experience. And to talk about that, we have somebody equally powerful who knows how to organize, how to advocate, how to encourage others to contribute and prepare the future leadership. And this is Carmela Castellano Garcia. Welcome to Muslim Network TV.
Thank you, Malik.
All right. Carmela is the President and Chief Executive Officer for last 23 years of California Primary Care Association, which oversees a membership association of more than 1,300 not-for-profit community clinics and health centers, which serve nearly 6.6 million patients a year. That's simply amazing, Carmela. How in the world you are able to do this amazing work? Do you get some patient here and there who say, well, I benefit from your work, or your work is a little distant?
Well, from visiting the health centers, I am able to interact with patients, and I do hear from them about the tremendous benefit that they're receiving from community health centers. But at the same time, my work is Sacramento-based, and I am involved in the political process of representing the community health centers who are on the ground serving patients every day. We're actually serving 7.2 million Californians.
I stand corrected, 7.2 million. So I think the public information on Google need to improve. Google is slower than you. Do you believe that, Carmela? You're doing an amazing job. Google need to catch up with you. Great, 7.2 million.
That's
wow,
correct.
what percentage of population of California that is?
There's 39 million people in the state of California. So community health centers are serving a very significant portion of our state.
Very significant. How come the world does not know a whole lot about community health centers?
That's a good point. We are one of the best kept secrets around, although ultimately more and more people are hearing about community health centers because nationally we are serving 29 million Americans. And health centers have grown tremendously, really as a result of Obamacare, some of the initial investments, which led to a tremendous growth in health centers. So, with the explosion of healthcare access in our country, community health centers have truly stepped up and are providing care to millions.
Hmm. Carmel, tell me this. In the situation of pandemic, in which a few months ago, everyone was struggling to get hold of one of the masks, and I know physicians and nurses who have died because they didn't have any protective equipment. How did the community center fare in that struggle to protect the people who are trying to serve?
Protective equipment has been a major challenge for our community health centers in California. So PPE shortages plagued us initially in the beginning. It was significantly challenging. But over time, that has improved. PPE is more readily available now. And so I'm pleased to say we have seen some improvements, but PPE shortages have plagued us the entire pandemic. And the cost of PPE equipment has just skyrocketed.
Hmm. And how is the supply of testing for the community health center? Because that also initially it was being controlled and it was being sent to places where they were saying we don't need it. Uh, how how were you able to help people?
Honestly, testing has been a debacle in so many ways. I'm pleased to say that 95% in our health centers are testing. 85% are providing mobile and drive up testing. So we are absolutely able to make testing available. What we have been plagued by over time is inadequate access to the tests themselves and extremely long waits for test results. Slowly, this has improved over time. And now the state of California is actually joining together to work through one lab and community health centers, 8 community health centers in the Central Valley. We're going to be a pilot program where we are going to be able to send our tests to the state contracted lab. And hopefully that's going to improve the turnaround times and access. But this is just a pilot. And it's good that they're targeting the Central Valley, which is one of the terrible areas where this pandemic is really an atrocity, the disparities that are impacting the population in the Central Valley. So we're glad to see the state focusing there, but there is a need for expanded testing and quicker turnaround times throughout our state.
Hmm. Do some of your centers have better facilities than the others?
Community health centers throughout the state, it is amazing some of the capital investments that we have seen in the community health center system, which didn't begin with Obamacare, but that was a major investment. It had been happening over time. You look at our health centers throughout the state with some of these tremendous changes. We have beautiful facilities throughout the state. And yes, there are some differences in terms of size and resources, et cetera. But overall, we have just seen tremendous improvement and growth in the capital that has been available to the health centers. And so we do see disparities in size of different types of populations that are served, et cetera. But our health centers are a strong system.
Hmm. Now, you were mentioning a minute ago about the testing time. How much time it was taking, which you expect to improve upon?
Oh, it was taking like a week to 10 days, which makes contact tracing and any form of really protecting people basically impossible. And that's why I'm saying we were really facing a testing debacle in the state of California. It's really a challenge when you have over 50 counties in the state of California, and the way that the all the testing and all this was handled by public health departments at the local level. So there wasn't a standard approach, much like at the national level, where states were left to their own devices. Really, in our counties in California, it was the same thing, where the public health departments had to try their best to collaborate locally around testing. And so that was a major challenge that we faced. But the state has increasingly gotten involved, as I said, like through this pilot project where they'll be working with this firm to try to advance testing. So I think we're definitely going to see improvements. However, it's not adequate and much greater improvements are needed.
Yeah, I mean, a week in getting results is just essentially useless because, by that time, thing has gone out of control in the family, in the neighborhood, and a lot of people who are in essential services without any protective equipment will further be contaminating whoever they will come in contact. So,
Absolutely. And we have worked hard, and some of it has depended on the relationship that an individual health centers has with the lab. And so some of our larger health centers were able to develop relationships where they were able to get quicker turnaround. So, like I said, it was not standardized. So it varied even from health center to health center, how long they had to wait, how much access they had to test. That was very unfortunate.
hmm. Kamil, tell me this. I mean, when I was studying this to prepare for this show, one of the most fascinating aspect of this was that the board of the community health center by law are required to have 51 people to be patient or former patient. I don't know whether the current patient or the former patient. That had when I just read, it was just a wow from my side. That's a real democracy in work. There are not many major institutions which serve almost 30 million people in the country who beneficiary could be part of controlling it in a majority way. How do you select those patients, or patients are elected?
Well, let's just talk for a minute what it means to have community in this way in community health centers. Because community health centers are from the community, they were developed from the civil rights movement, they came from the community. And so it makes sense that in the way community health centers were designed, it is a legal requirement that 51% of their board of directors be patients of the health center. And you're correct, that does make us very unique as a nonprofit and as healthcare systems that we are governed by our patients. But to us, that is really how you put community in community health center. And so these patients actually, these community health centers are independent nonprofit corporations. So an individual clinic, and we actually have about 800 corporations in the state. I'm sorry, 300 corporations in the state that have multiple sites, and that's how we get 1,300 sites. But those 800 corporations each have their own independent board of directors that is selected. Ultimately, the founding board continues to grow and select board members as they evolve off due to term limits, et cetera. So these nonprofits have their own governance, they have their own process for selecting their consumer board members, which is what we call the patients. They're called consumer board members.
That's amazing. Do since some of these things are dictated by the federal civil rights laws, are there, standard bylaws which they follow in all these corporations, or there some bylaws are more democratic than the other? Have you seen some of these bylaws?
I have, but overall, the health centers are governed by Section 330 of the Public Health Services Act. And within that, it is the Bureau of Primary Health Care at the federal level that provides a very high level of regulatory oversight around things like the consumer board member requirement. So the federal government does review the bylaws of community health centers to ensure that they are complying with whatever the federal requirements and mandates are concerning governing boards. So there are mechanisms in place where the federal government does review that to ensure that those requirements are met. And I think that's a very important thing about community health centers to understand that community health centers work very closely with the federal government. They're very highly regulated and tracked, and this really helps with our quality outcomes because health centers are accountable to the federal government for achieving results for their population.
Hmm. That's amazing experience. I wonder if somebody has done a PhD dissertation or some research just on this phenomena. An
Consumer board
institution
member.
which serves almost 30 million people running so democratically, and they collaborating with each other at the state level and federal level to achieve result, and they continue to benefit the communities. I mean, this seems to be one of the strongest contribution of the civil rights movement, along with the voting rights and other things, don't you think?
Well, I think it certainly makes us unique and really special because when I talk about community and community health centers, and we are unique in a lot of ways, because community health centers, first of all, in our mission, and this is also under federal law, we are required to serve all patients, and that's regardless of their ability to pay, their immigration status, their language access. We are open door providers. We have a mission and a legal mandate to serve all comers in our community, and to do that in a manner that is culturally and linguistically sensitive and addresses the needs of the patient population. So I think community health centers, like I said, they're from the community, they're in the community, they're governed by the community. And in these ways, when you add that governance piece, I agree with you, Malik, it does truly make us unique. And especially with the 29 million patients as part of the healthcare fabric of the country. You're not going to find any other segment of the industry that is governed in such a manner by the patients, where they're empowered in the way they are in health centers.
Amazing, truly amazing. Carmela Castellano, let's take a short break. And you're watching Muslim Network TV. This is Imam Malik Mujahid talking with a amazing leader, Carmela Castellano, who is leading the California Community Center Coalitions. And we'll be right back after these messages. Salam, this is Malik Mujahid. I want to talk to you about something extremely critical. Disney is collaborating with the Chinese government and profiting from genocide in China. Chinese government has thrown more than 1 million people in the concentration camp, largest concentration camps since the Nazis, and the world knows about that. They have taken 500,000 children to Chinese communist orphanages, and they have placed 2 million Chinese in 2 million Uyghur homes. World has never seen anything like that. We said never again before, and we must mean never again. And Disney can't believe that. Disney is not only profiting from Mulan movie, they are depicting Chinese invading indigenous people and slaughtering them. And at the top of it, they are thanking the Chinese Communist government. To be exact, 12 departments of China, and some of them are directly involved in maintaining and pushing people in the concentration camp. Could you believe that? I had a hard time until I investigated. Could you please sign this petition to the Disney, which is a company which cares that they must not profit from genocide. They must stop this thing. Whole world is speaking what's gone wrong with Disney. Profit cannot be made when a genocide is taking place. Please sign it now. Thank you. Peace.
Assalamu alaikum. Open up your eyes.
Assalamu alaikum everyone, it's your brother Zain Bika from South Africa. One of the first educational programs ever produced for Muslim children was the ever popular Adam's World series. The colorful and comical Muslim puppets stole the heart of a generation. Sound Vision will be releasing brand new episodes of Adam's World with the launch of a Adam's World app. Subscribers will enjoy new Adam's World episodes as they are released, as well as all the classic episodes of Adam's World. So visit adamsworldapp.com now to learn more, subscribe and enjoy new adventures of Adam and his friends. And let's keep helping tomorrow's Muslims today. Assalamu alaikum.
It's Adam's World. Believe me, there's a lot to see. Bismillah. Let's explore.
Welcome back to Muslim Network TV, and this is Imam Malik Mujahid talking with Carmela Castellano. Uh, so in California, there are 1,300 centers run by 800 organizations. How many are this around the country?
Around the country, we are, and I have that nationwide, we're 25, well, we serve 25% of all the patients in the country. So that's one thing about California being large. I'm not remembering the number nationwide.
So how many did you said you serve 7.2 million patients a year?
That's correct. In the state of California alone.
Okay. Now, do you anybody who walk in, you serve them, or you check their income level and IDs?
Well, we are, like I said, we are open door providers, and income level is relevant to what we have in place, which is called a sliding fee scale. So under federal law, community health centers do charge based on the ability to pay, which does mean some patients pay zero, in fact. So income is a relevant factor for determining also eligibility for state or federal programs such as Medicaid. What is not relevant ultimately in terms is the immigration status in terms of we are an open door provider that is going to serve anybody regardless of their immigration status.
Tell me, is this system of community health center, is it since it has been in place for a long time, is it strengthening or weakening?
You know, in my opinion, the community health centers have been strengthening for a period of time. You know, some of the investments that really began in community health centers when we really started to grow was actually under the Bush administration. There had been a lull in an investment in federal dollars, but President Bush began an initial investment to grow the health centers. That was actually his healthcare access initiative, was to grow health centers. And that's when we first saw some growth in California. But then it really was explosive with Obamacare. And for example, in California alone, almost 200 sites were added. That's new health centers in communities where they didn't exist before under Obamacare. When you had also prior to Obamacare, a large, significant portion of our patients were uninsured, which is a major financial challenge to the health centers. With Obamacare, many of those patients gained Medicaid. Medicaid is a much more significant payer for community health centers. So we were tremendously strengthened under Obamacare. We had many patients come to our health centers, so we had explosive growth. And then those health centers, those patients came with insurance, with Medicaid insurance. And so our health centers were in a financially stronger position after Obamacare because of having patients who are now insured and because of very significant federal investment. There was a $10 billion investment in community health centers nationwide in Obamacare. No other sector of the healthcare industry received a federal investment like that. Over $1 billion came to California to fuel our growth and expansion. So after that, we were actually in a very good position. I think COVID has certainly undermined our financial position to a significant extent. I want to just say that when the COVID first hit and we had to basically shelter in place, our health centers emptied out. And one thing to keep in mind about community health centers, we are paid by the visit. So if the patients don't come in, we are not paid. There was a financial free fall that happened in community health centers when COVID first struck. And remember, California is the first place where the shelter in place orders came into effect. And I just want to say the policy change that pretty much saved the health centers from financial ruin was our ability to secure telephonic and telehealth visits and reimbursement, Medicaid reimbursement for those visits in California. And I'll tell you, even today, half of all visits happening in health centers in our state are telephonic. So it's really a very
50% of those. So that's substantial.
Currently, that's correct.
How much of those are through phone and how much through Zoom?
The lion's share are through phone. And I'll tell you why. There's a big digital divide in this country and in the state of California.
Mm.
And our patients are truly challenged with access to broadband and ways that they could really do the Zoom and the more complex video conferencing. So telephonic is ruling the day in the state of California, and it has expanded and allowed for access. If it wasn't for that, our patients would not have been able to be seen during these last 6 months.
Carmela, isn't this a big commentary on the state of our affairs? That a state where the Silicon Valley is in place, which is leading the world in digitally, there are tens of millions of people who cannot benefit from the same thing.
Well, let's just talk about Silicon Valley itself. That's my hometown, San Jose, California. I'm living in Sacramento now, but certainly have ties to that community. And yes, it was very discouraging to see in Silicon Valley how the city council had to move very quickly to expand internet access to one side of town, the side of town where Latinos and African Americans and the Vietnamese population is concentrated, because that was the part of the city where the children did not have the access that they needed for school in terms of internet. So just to see that digital divide right in the heart of Silicon Valley, I can imagine what it's like in the rural communities of California with very high poverty and very much challenges to that internet access. If we've got that happening in the heart of Silicon Valley.
You mentioned President Bush contribution, and then you mentioned President Obama's contribution in response to whether it's a weakening system of healthcare center or a strengthening system. You know, in America, almost everything gets partisan nowadays. I mean, look at the climate change. It looks like it's a partisan issue, which it deals with all the planet and all human being and everyone in there. Do you think that community health center have remained a bipartisan issue?
Absolutely. And that is something we're really proud of. You know, community health centers offer care in all parts of the country and in all types of communities. And I'll tell you, like in a state like California, in rural communities, community health centers are the only provider around for entire populations. And I think the fact that we're providing such tremendous access is part of our bipartisan appeal, because we're in all communities providing access to all. And I think our political leaders recognize in their community that there's going to be a community health center providing a very critical need. So yes, we have always enjoyed bipartisan support, and that's been very important to the success of community health centers.
Yes, and I think in part you benefit from it that not a whole lot of people know about such a successful major program, so it remains outside the political football, I guess, in some ways. But
Well,
then,
you
how
know,
do you?
I don't want to say that we haven't been a political football, because we have. So we do get caught up in that as well, but ultimately we still maintain our the bipartisan support.
And that is because you're serving in the area, and constituents are telling different parties that, hey, this is what I need.
Well, I think the community health centers are also very good about working with their elected officials. I know they can sometimes be a best kept secret in the community, but our politicians, whether it's at the local board of supervisors, city council level, at the statewide assembly and senate, or in Congress, are very well aware of community health centers. We're just too important of an asset and resource in the community for political leaders not to know. And the community health centers do a great job of working with their local elected officials, making sure they come visit the health centers and know about the great services we provide. And our local electeds need to know this too, because people call their district offices when they need access to health care. And our electeds refer them to health centers.
Well, seeing the amount of money which you're getting, and maintaining, despite getting into political football, is still maintaining a bipartisan support thanks to your services. How do you plan advocacy?
We are very fortunate to be affiliated with the National Association of Community Health Centers. So our health centers have a national DC-based association that represents our interest in Congress, but in coordination with all the states. So the California Primary Care Association is a member and works lockstep with our national association on the federal political agenda. And so we support through Congress here the priority initiatives and take the lead from our national association, doing that in concert with all the states. Now, at the local level, I want to tell you something very unique about California. Not only do the health centers, are we fortunate to have the California Primary Care Association, but we also have 16 regional clinic associations. So, for example, the Community Clinic Association of Los Angeles County is its own nonprofit with its own CEO that also affiliates with CPCA and partners with us and brings advocacy at the local level. So this is a tremendous infrastructure that our California health centers have that is necessary because of the size, scope, and magnitude of our state. And that is unique that we have these local clinic associations that assist with the political education and lobbying at the local level. So that is the kind of infrastructure that we need in the state the size of California to really be a player in the political system. We're fortunate to have that.
So multi-layer. So there are clinics who can influence the local politicians. Then there are their associations who can go on more regional and county level. And then you come in, all 1,300 clinic represented by 800 organizations who work with you. So how you come into being? Those 800 organizations are equal partners, members. Do they pay dues?
Absolutely. They pay dues. We have a board that is comprised of 30 board members. They are actually democratically elected by the membership. So we are absolutely a member-driven association. Not only do we have those 30 board members, but we have a large number, I believe it's 10 to 12 committees, functioning committees that lay out and drive the policy and programmatic initiatives of our association. The representatives on that board are CEOs of clinics throughout the state, medical directors, as well as some of the CEOs of our clinic associations. And our committees are open to the membership. So our legislative committee have 150 people on it. And it's a democratic process that our members drive the agenda and give the input. And that's something I'm very proud of.
Tell me, yeah, definitely you have all the right to be proud of this service which you are providing in such a democratic way. Tell me, are there some, those 51% patient and consumer who have gotten to board, have some of them risen to the level of being represented in your association?
Absolutely. We have had consumer board members on the association board of directors over the years. And another place where I've been so pleased to see their participation is in our annual advocacy days. We have a major advocacy day in California once a year, as well as in DC, and then other periodic advocacy days that are smaller in nature. And our consumer board members are very well represented in those lobbying visits. And they play a really critical role because a member of Congress, we have found physicians are very effective and patients. And so I have seen our consumer members in DC and in Sacramento taking a lead on telling their stories and advocating directly with elected officials. And that has been wonderful to see the empowerment of them and how their voice helps lead and influence our electeds.
How many advocacy days do you have in Sacramento or in Washington, D.C.?
Well, there's a large one every year. So we have our advocacy day usually in April or May for community health centers in California, and the National Association usually has one in February or March. But then as urgent issues crop up, there are also, we might convene on short notice sometimes too, more urgent advocacy days. We actually call them fly-ins. And so they were fly-ins where we go en masse to advocate. But another thing I've really noticed, we had one of those advocacy days in California during COVID, and we had to pull it together under short notice. And you know, one of the interesting things I found through Zoom, that we actually had some great access to our elected officials, and we avoided having to get on planes and all the expenses. And I'm kind of excited that the Zoom approach could open up advocacy at some of the grassroots level, because it's not the same level of time and travel and cost commitment. So I'm hopeful that we need to continue with this type of advocacy, and we have been. And so lobby days will continue, COVID or not.
So how many people on the lobby day physically used to come, and how many are doing through Zoom?
Well, I could tell you in California, we had over 300 people converge on the Capitol for our annual lobby days. And we had to cut off registration at some point. So it could have been more. Through the Zoom process, when I was in those meetings through Zoom with legislators, the numbers looked the same. So it looked to me like we had similar participation through the Zoom.
And you say it's tons of money and time.
Absolutely, yes.
Okay. Well, you're watching Muslim Network TV on Galaxy 19 satellite, Apple TV, Amazon Fire TV, on our own website, muslimnetwork.tv. This is Imam Malik Mujahid, and I'm talking with Carmela Castellano, and we will be right back after these messages.
What was it like when you started this network out, when you started Sound Vision those many years ago?
You know, after 9/11, one lady called me and she says, what is your channel which I can watch? And I say, I'm sorry, we don't have a channel. And you know what she said? She said, then how America will know about you?
SubhanAllah. Anything you want to say to the people who are watching? That we had one sister who messaged that she grew up on Sound Vision. What do you say to the people who have been long supporters?
Thank you. Thank you. It is because of you we are able to do all of that. So the generation of Adam's World, you need to take it over for the next generation. And that's my invitation to you. So keep telling everybody where to watch. They can watch it on Galaxy 19 satellite, Amazon Fire TV, Apple TV, or easy thing, muslimnetwork.tv, or our YouTube channel, or our Facebook channel. And with your help, inshallah, ladies, the one who called me, what channel should I watch Muslims on? Answer is here and now.
Open up your eyes.
Assalamu alaikum everyone, it's your brother Zain Bika from South Africa. One of the first educational programs ever produced for Muslim children was the ever popular Adam's World series. The colorful and comical Muslim puppets stole the heart of a generation. Sound Vision will be releasing brand new episodes of Adam's World with the launch of a Adam's World app. Subscribers will enjoy new Adam's World episodes as they are released, as well as all the classic episodes of Adam's World. So visit adamsworldapp.com now to learn more, subscribe, and enjoy new adventures of Adam and his friends. And let's keep helping tomorrow's Muslims today. Assalamu alaikum.
It's Adam's World. Believe me, there's a lot to see. Bismillah, let's explore.
Welcome back. This is Imam Malik Mujahid with Carmela Castellano, and you're watching Muslim Network TV. One of the things about advocacy, do you also have professional lobbyists at Washington, D.C. and Sacramento, or you do it without them?
You know, we absolutely do have professional lobbyists both in DC and in Sacramento. And that's been an important piece for us to have access to lobbyists. Been doing this forever. But at the same time, CPCA staff, including myself, are very much involved in that process too. And alongside our lobbyists are representing the community health centers, both with elected officials and in Sacramento in terms of testimony, et cetera. So it's really a combination of our staff who really build up a tremendous expertise over many years working with our professional lobbyists.
And do you, are just funding comes from the government and whatever you charge your patient, or some foundations and not-for-profit also contribute to community centers?
You know, community health centers have a pretty diverse funding stream. Medicaid is the backbone of our funding because we serve a very low income population. And after Obamacare, with so many people having access to Medicaid, that is the major payer. Medicare is another payer for the elderly population, growing tremendously, and community health centers have taken on an increasing role. Although the elderly is still a smaller segment, we mainly serve women and children. So Medicare, Medicaid, third party, private insurance. I mentioned those rural areas where community health centers might be the only provider to everyone. Those health centers have a very significant of their revenue coming from private insurance or people who are getting their health care on the exchange under Obamacare. Then in addition to this, when we talk about government funding, there are just a myriad of categorical programs in California and national other funding streams that health centers have access to, such as I mentioned the Bureau of Primary Health Care. Federal dollars flow significantly to the federally qualified health centers in the state of California and nationally. So federal funding is another significant component. So it's really a mix of funding. And you mentioned philanthropy. Absolutely. Philanthropy has made a big investment. I'm very proud to say in California, we are so fortunate to have some very significant healthcare funders due to some of the conversion foundations that were created when some of our major health plans went from nonprofit to for-profit. We had some major conversion foundations, some of the largest in the country. So there are healthcare dollars in California, and the community health centers, particularly over the last 15 years or so, received over $100 million of investment in philanthropy. And our association.
Carmela, help me, sorry to interrupt you. Help me understand, what is this conversion process?
Well, this is where, for example, Blue Shield of California at one point was a for-profit and a nonprofit and converted to for-profit. And under California law, if you're going to do that, you have to establish a foundation to pay back the community for all the years that you benefited from nonprofit status. For example, in California, two very well-known foundations that were created out of one of these conversions is the California Endowment and the California Healthcare Foundation. And then about a decade before that, the California Wellness Foundation was created from another conversion. So it's the way that our law works in California. These nonprofit plans, they're not able to convert to a for-profit without paying back the community for all the benefits they receive for those years of nonprofit. So this is multi-billion-dollar foundations that have been created with the mission to expand access in the state. So community health centers have been very well positioned with this particular foundations to receive an investment, and they have over many years.
That's fascinating. Is California anytime going to declare its independence from America?
Well, you know, it certainly is a leader in showing America the way to go. And so I'm very proud of that.
Something which is somewhat confusing. There are big hospitals which are not necessarily community health centers, but they also write with their name community clinic, community this and that. What is the confusion?
You know, I don't know that it's confusion as much as really understanding that best kept secret and the value of community. And what I think it is that these Obamacare really expanded access to a much lower income and diverse population, especially in the state of California. That's our bailiwick. Community health centers have been serving the most low income, diverse, uninsured populations of California for decades. Now with Obamacare, healthcare has expanded tremendously to this population. Actually, our physicians became very popular after Obamacare and were recruited very vigorously by all sectors of the healthcare industry because our patients, our physicians have years of experience providing culturally competent healthcare to this population. So I think what happened is community health centers and our model of care after Obamacare actually became recognized and valued because what Obamacare helped do was promote the idea of prevention. For the first time, a national law prevention fund was created. There was an emphasis on primary care, and Obamacare really brought that to the forefront, an investment in primary care. So health centers and the concept of community was picked up and noted by other segments of the healthcare sector. Let me give you an example. Before Obamacare passed, I was on gave many speeches and panels where everybody was concerned. What's going to happen to health centers? What's going to happen when our consumers have a choice? Are they going to pick community clinics? And I kept saying, oh, I think we're going to be very popular. And you know what? Turned out to be the case. Over half of all the individuals who received healthcare, uninsured people before, over half of them chose to get their care at a community health center. So our model of care, which is community-centric, community-focused, culturally competent, preventive, and focused on primary care, became a model of care. And I think that's why you're seeing other kinds of providers now adopting community or even community.
Oh,
Okay, that's what I believe is happening.
wow. So that is you're popularizing focus on community, so it became a marketing tool for some people.
Cultural competence, yes, and community access, yes, community inclusion.
Well, I don't think they are borrowing the 51% consumer being on their board.
Absolutely not. And in fact, every time the 330 Act is reauthorized, there are people out there lobbying to eliminate that provision. And I will tell you, our National Association, as well as all the primary care associations in the country, we fight very hard to keep that provision in law.
Because that keeps its focus and toes on the ground, I guess.
Yes, because people want to remove that provision so that they don't have to have the community accountability, but would have access to the dollars.
Well, historically, this community center came into being at the heel of the civil rights movement, correct?
That's correct.
Now, with having access to 29 million people across the country, do you somehow play a role beyond health-related issues in the further strengthening of the civil rights?
You know, community health centers are ultimately kind of like the fabric of the civil rights movement, and we are the meaning of social justice because community health centers are all about access to the community in a way that's going to empower and enrich their lives. And so with community health centers, we really don't just focus on healthcare. And community health centers, because of the tremendous disparities our populations face, we've had to look even beyond healthcare and other types of services and needs in the community. And that's everything, from housing to food to trying to address issues of domestic violence and really looking at the social determinants of health and the other issues beyond healthcare that are impacting our community. And so as a result, our association has had to stand up on some of these broader issues, and we have to have a broader view of health. It can't just be about health care. We have to look at the overall health and well-being of our communities.
Carmel Castellano, tell me, you have been on this job for 23 years, so you must be probably in love with this job. How you got into this type of work? I mean, this is a very unique work. Were you some type of a lobbyist or some type of an advocate for other causes, and you develop your profile before you found this job?
I was a young lady in San Jose who grew up in a home that was very socially conscious. And my parents, Alcario and Carmen Castellano, were just very social aware, very politically active. And I became aware of disparities and diversity issues my entire life. And I think seeing the inequities in my own hometown of San Jose, California, where I mentioned the Latino community has been marginalized historically. I went to law school with a desire to change and do something in my community. So this was something I had wanted to do from my teen years. And so when I went to law school and ended up in a civil rights firm, out of law school, Public Advocates in San Francisco. And that was actually when Clinton was introducing healthcare reform. And I had the tremendous opportunity to start an organization called the Latino Coalition for Healthy California, because there was no Latino voice in healthcare in the state of California back in 1992 when Clinton was introducing healthcare reform. And Latinos stood to benefit the most because we were the most disproportionately uninsured as the working poor population. So through Public Advocates, I was able to work on Latino issues. And if you're going to address the Latino community in healthcare, you're going to work with community health centers. I mean, community health centers, 55% of our patients are Latino. And so I was very much involved in the healthcare access issue from the beginning of my career. And I think that was just to meet my desire to do something that was going to benefit the community. And what I'm so pleased about being with the Community Health Center movement, moving on from the Latino Coalition for Healthy California, is because it's about all low-income, vulnerable populations in California. Latinos, Asians, African Americans, poor rural communities, the homeless, immigrants, you name it, community health centers are serving these populations. And so I've been able to expand from just serving the needs of Latinos to looking at all vulnerable populations. So do I love my job? You bet I do, because this is why I went to law school, which is to make a difference. And I'm so pleased to say when I started at CPCA, the community health centers were serving about 2 million patients, and now they're serving 7 million. So I do feel good that we've expanded access to millions of Californians during my tenure at this association.
Amazing. I mean, I meet some young people who go to law school, and when I tell them why, because there's a glut of lawyers in Illinois, at least, and they tell me the exactly what you're telling me, to serve people by fighting. So advocate sometimes seems to take a route of law school, it seems, and it's a. So tell me the secret, other than patient being focused on serving and working with people and having this, in the family. What are your political secrets of remaining in power for 23 years? I mean, I can challenge you on 2 points. Maybe you're politically smart, or maybe you're ensuring that nobody is ready to replace you.
Well, first of all, in terms of my approach to survive in this position for a long time, the way I see it, and I saw it from the very beginning, it's imperative to achieve results. This is a member association. I have a board of individuals where their industry is directly impacted, their bottom line, by what this association does. And so I think having a focus on achieving results, hearing my members and having them dictate the priorities, and then doing our best to go and secure what those priorities are, I think has been part of the secret for my success, because I really try to focus on what their priority needs are. Now, in terms of whether I'm doing that to, perpetuate myself within the association, I want to tell you that I have been implementing a really exciting plan for a number of years now, which is about the future leadership, not only of this association, but of the community health center movement in California. So let me just tell you about the two components of that. Number one, I have been focusing on leadership development within my association for about the last decade in a way that is focused on building up the leadership from within. So I have a team of vice presidents where out of that team, a good number of them basically grew up in the association. They might have come in as a coordinator a decade ago. I've got one who's a vice president of government affairs now. And I was very much committed and devoted to helping move these individuals along within my association so that we would have people who were really much trained in and brought up within the health center movement. And so now I have an incredibly powerful and strong leadership team that has been with me for a long time, that grew up within our association and established their strength over time. And I'm very proud of that. And so I think, that's really the future of the health centers. If I were to go and move on, I've got an incredible team. I mean, my board would have great people to pick from who they would want to see as the next leader, or I think we could attract a tremendous leader, because really my succession plan has been to create a killer association. And when I came 23 years ago, it was a small group. When I joined, there was one staff person left. They're gone. They left right away. I'm so proud to say now we have 50 individuals. We're hiring 10 more right now. We're in a growth mode. Our association is just really in an incredible position. But I think it's been years of focused leadership development and focusing on the results and hearing what it is that our health centers need.
Great. Tell me this. What are the future plans for you? Are you running for office somewhere?
No, I'm not running for office, but just another leadership issue I'm really committed to in terms of future plans with this association. We intend to take on the issue of leadership development for building the future workforce of community health centers. We are currently developing a leadership program that's going to target individuals for the C-suite of the community health center movement. We want to build and groom and grow a diverse set of leaders for the succession planning of community health centers. So I'm committed to not only investing in my own association, my own leaders, but really in the leadership of the movement. And that's something that's going to be so important for our future. So I'm very excited about that.
Well, thank you so much, Camila Castellano Garcia. It has been a pleasure to talk to you, and good to meet a leader of the community who's serving community, preparing the leadership. Thank you so much for your time. Truly appreciate it.
Thank you for having me.
And thank you, Dr. Abdul Wahid and Sherdil Khan, for producing today's show. You're watching Galaxy 19 Satellite for Muslim Network TV. Muslim Network TV is also on Amazon Fire TV, Roku, and Apple TV. And you can always watch us on muslimnetwork.tv, which is our website, muslimnetwork.tv. Peace. Salam.